Good afternoon, dear members of the Advisory Committee. It's a pleasure for me today to be able to deliver my observations as the UN Special Rapporteur on the negative impact of unilateral coercive measures on human rights, on the impact of unilateral coercive measures, means of the enforcement and overcompliance, on human rights in general, as well as on the healthcare situation as regards the most vulnerable groups. Today, the world is observing the expanding use of unilateral coercive measures in different forms. We cannot speak about the use and negative impact of economic sanctions only. We're talking about application of economic, financial sanctions, trade limitations, the sectoral sanctions affecting the whole spectrum of economy, impediments to deliver or impediments to ensure delivery of certain goods, prohibitions to trade with specific types of actors or a country as a whole, additional limitations. Unfortunately, targeted sanctions, which are presented to target so-called bad guys, are in reality not targeted at all. Targeted sanctions against the highest state officials, including the head of a state, in particular affect the whole country, preventing the third parties, including governmental and non-governmental, and even the United Nations, from cooperating with the public sector of economy, for sure, and quite often with the private sector having any nexus to the country under sanctions as well. It shall also be taken into account that the world is currently observing the expanding use of the means to enforce unilateral coercive measures. They are different means. We are talking about secondary sanctions for circumvention or alleged circumvention of primary sanctions regimes, criminal and civil penalties for the same matters, reputational risks, maximum pressure campaign, as well as hate campaigns against the states, companies, and individuals. Due to the overlapping regulation in the sphere of unilateral coercive measures, the very vague interpretation being quite often extremely broad, overlapping sanctions regime, higher level of penalties for sanctions circumventions, we are currently observing a growing level of overcompliance worldwide. As a result, it's not possible to assess the impact of sanctions of a specific country on the human rights of individual or on the healthcare sphere in general. At the same time, we can only assess the compound impact of the unilateral coercive measures, means of the enforcement and overcompliance altogether, due to the activity of the public and private sector in this sphere. As a result of 6 years of work as a special rapporteur, I have identified that the whole scope of sanctions, means of the enforcement and overcompliance, have a comprehensive impact on human rights people worldwide, affecting the general population, and the most affected are usually the most vulnerable groups, including people suffering from rare or severe diseases, pregnant women, women delivering babies, children, which quite often might be deprived even of the basic vaccination. We start to have the outbreaks of diseases which are easily preventable, like measles or, for example, the polio. We shall also note the indirect effect of unilateral coercive measures, means of the enforcement and overcompliance on the health sphere. It's not only because of unavailability of medicine or medical equipment. People face challenges to get to the hospitals because their transportation is not able to function any longer. There is no electricity in the hospital, or even water supply is prevented. As a result, in many countries under sanctions, we face the distribution of water-transmitted diseases. Many people are not able to cover the healthcare costs. And even in the countries which used to provide the full coverage for people suffering from severe diseases or persons with disabilities, I have been reported that many such people change their medicine at the black market to food in order to support their own families. It's also necessary to note that the unilateral coercive measures, means of the enforcement and overcompliance, are creating conditions conducive to healthcare insecurity. I'm talking about the growing poverty rates, insufficiency of medical doctors, impossibility to train properly medical doctors, food insecurity, as well as insufficiency of water. In many countries, impact of unilateral coercive measures against other countries is exacerbated by impossibility to get assistance from the other states. In particular, less than a year ago, the United States has threatened to lift visas from any countries using Cuban medical doctors programs. And this program is used to ensure the health care in the neighboring countries as well as many other developing states, affecting rights of people there. It's also necessary to mention that humanitarian action is very complicated in the face of UCMs. I'm talking about the possibility to deliver food and medicine, which are formally excluded from sanctions regulations. However, in practice, the delivery of food and medicine even is very complicated and very expensive because it needs multiple licenses and quite often is not possible due to the impossibility of payments, delivery, and insurance, as well as fear of the producers of quite often unique medicine and medical equipment to have any nexus to the countries under sanctions. Similar situation exists when we are talking about the impact of unilateral coercive measures on humanitarian assistance in the face of natural or man-made disasters. I'm referring, for example, to the earthquake in Turkey and Syria in early 2023, a Hurricane Melissa in Jamaica and Cuba last autumn. As a result, countries under sanctions like Syria and Cuba were able to receive 25–30% less assistance than the neighboring countries, as well as they were not able to get any support from the side of the emergency funds. I haven't been addressing the issue of impact of unilateral coercive measures on the health care of people in vulnerable situations. However, quite a lot of work has been done in this sphere. In particular, I have established and launched Sanctions monitoring tool, which explicitly demonstrate the impact of unilateral coercive measures on different elements of the right to health. Additionally, my report presented to the Human Rights Council 3 years ago about the impact of UCMs on the right to health provides the general overview of the situation as well as addresses the impact on some of most vulnerable groups. Upon the request of multiple humanitarian actors, I launched the development of the guiding principles on humanitarian actions in the unilateral sanctions environment. After 2 years of work, it's already finished and the guiding principles can be found on the web page of the mandate. To be able to discuss these and some more very important issues, including the access to effective remedy and responsibility in the face of UCMs, I'm launching a conference in Geneva in April 9th and 10th, and I'm inviting all of you, dear members of the advisory committee, as well as other stakeholders, to register and to take part in this conference to be able to discuss the humanitarian impact of unilateral coercive measures, impact on the vulnerable groups, as well as humanitarian actions in the same environment. I hope that the addressing the issue of the impact of UCM's means of the enforcement and overcompliance on human rights of vulnerable groups, especially in the sphere of healthcare, will help us to address the issue and protect rights of these people. Thank you very much for your attention.